He was, of course, a businessman first, and today President Trump employed those skills on a trip to Capitol Hill with a sales pitch to House members that it's time to close the deal on repealing and replacing Obamacare. Chief White House correspondent John Roberts joins us tonight on the North Lawn with what President Trump told Republicans today and where the head count stands tonight. Good evening, John.
Not looking good at the moment, Brett. The president is driving toward a vote on the new health care bill for the day after tomorrow, but at the moment, passage of the new measure looks like it could be in jeopardy. President Trump spent some political capital on Capitol Hill today, lecturing the House Republican Conference on the need to pass health care reform or pay dearly for it in the 2018 election.
We had a great meeting, and I think we're going to get a winner vote.
On the way out, the president insisted things were looking good for a Thursday vote. House Speaker Paul Ryan was over the moon.
The president just came here and knocked the ball out of the park. He knocked the cover off the ball in explaining to our members how it's important to unify, how it's important to work together.
But some conservatives remain unconvinced.
I thought the president did a good job, but that doesn't change the four corners of the document. What's in the legislation itself is what is the concern. And our focus has been real simple. Let's do what we told the American people we were going to do. This bill doesn't do that.
At one point, the president singled out Freedom Caucus Chair Mark Meadows, joking that if Meadows didn't get on board, quote, "I'm coming after you." Meadows, whose Freedom Caucus still has 21 no votes, nearly enough to defeat the bill, says only voters in his district can send him home. Conservative groups who met at the White House with the president on health care are actively trying to defeat the bill. Heritage Action is urging a no vote, while the Club for Growth is running ads, evoking the specter of Obamacare in the new bill.
Now Congress is pushing Ryan Care, a bad idea doubling down on disaster. Washington's still in charge, premiums even higher, millions more uninsured. It even keeps Obamacare's tax hikes.
The House Speaker is throwing a bone to conservatives, proposing major changes in a so-called manager's amendment.
If you take a look at what we've been able to add to this bill, the things that are huge conservative wins, giving states the ability to take a total block grant for Medicaid, giving states the incentive to have work requirements, preventing non-expansion states from expanding and gaming the system.
But as the president continues to meet with lawmakers to cobble together the necessary 216 votes, it's becoming clear that more may be needed. May he seek more changes in order to further assuage?
It's possible, but I think that we've made some very positive steps forward. So I don't want to, rule anything out. But I will say that I feel very good about this where it stands now, and I think the more and more that members meet with the president, the more they understand how important this is to the overall agenda that we're seeking to pass.
That reference to the president's overall agenda, Brett, is about tax cuts. The president reminding Republicans who campaigned on them that if they ever want to see tax reform see the light of day, they've got to do health care first. Brett?
Thanks, John.